Welcome to another Cutting Edge Show. I'm Omar Neal, one of your hosts. I'm the former mayor of Tuskegee, Alabama, and host of the syndicated You Got the Power radio talk show. This is going to be a wonderful show. Don't forget, this program is being brought to you in part by the University of Maryland School of Public Health. This is the Cutting Edge, where we discuss all things health and wellness, COVID-19, and beyond. You know, when I say this is going to be a powerful show, this is going to be a powerful show. There are times by which you have moments where you have to say, this is the moment to have this conversation. For me, this is the moment in the last few weeks, even very close people to me have had issues with the heart. I've had relatives to transition as a result of heart-related illnesses. I've had very close people go to the hospital ICU within the last few days because of issues a matter of the heart. And so we're going to have this show, this conversation about the matter, a matter of the heart. We got a great lineup for you. We have Dr. Renee Dismaris, who is a cardiologist. We have a regular for us with us today, Aaron Perry, who is not only a barber, but also has a health clinic within his barbershop, men's health advocate, and founder of the Perry Family Clinic. And of course, we have Dr. Ambreen Muhammad, who is a cardiologist as well. You're talking about a powerful lineup. We got it for you today. So those of you who are listening, I want you to go around and call around to your family and friends. Everybody needs to be listening and watching this show this evening. Now, you know that I don't do this by myself. I got this guy that I call my brother from another mother, my sidekick, Dr. Stephen B. Thomas. We call him Dr. T amongst these parts. He is a professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. Ladies and gentlemen, please join me in welcoming my co-host, my co-moderator, my sidekick, my brother, none other than Dr. Stephen B. Thomas. Hey, Dr. T, how you doing today?
Hey, Mayor Neal, it's always good to be in a space with you. And what a show we have tonight, a matter of the heart.
Wow.
You know what, my friend?
Yeah.
I think everybody's going to, if we were to say, raise your hand if you know someone who has suffered from heart disease or transitioned, as you say, from heart disease, raise your hand. And I think almost every hand would go up, Mayor.
Right. Mm-hmm.
It's the leading cause of death in the country.
Right.
And yet we know now more than we've ever known about how to prevent many of the diseases of the heart. So I love our title tonight. It's a matter of the heart in so many ways.
Absolutely. Well, obviously, this is very important. But we don't do this by ourselves, Dr. T. Right? we got a team behind the scene that makes this work, headed up by Meg Jordan, our technical director. Saraya Khan, who is our social media coordinator, and our sound designer is Elijah Pugh Jr. And one of the things that's so important is that not only are we on just Facebook and that, but we really run the gamut of our social media presence. We're on Facebook, we're on YouTube, Instagram, Twitter, and others as well. And one of the things that we do as well is we have a newsletter that comes out each and every week. It is just a wonderful document electronically sent that chronicles the activities of the Cutting Edge Show. We also archive our segments and our shows, and we put them back on our newsletter so that if you miss the show, you can catch up, and it's always going to be there. So information that you can use, particularly as it relates to health, COVID-19 and beyond. So, you can see that QR code there. I hope that you got that and you can subscribe right there with the QR code. Well, Dr. T, you ready to rock and roll?
Let's do it. You better buckle your seatbelt.
Buckle your seatbelt. Pow! You know,
Here we go.
let's make this thing happen. Let's bring up our first guest. Let me just meeting him just like right now, like just a few minutes ago. You know, we said something about, you know, your best friend in the whole United States world kingdom. Just act like you're talking to them. And then, you know, and then I say act like. He said, why you say act like? I am. You know, that's the kind of spirit that he brings.
That's
Dr.
right.
Rene Desmiris, who is a board certified cardiologist. He serves as the attending cardiologist at the Tide Health Salisbury, Maryland. Is that right? Is that how you pronounce it?
Yeah, Salisbury. You got
Salisbury, Maryland. And of course, he holds the position of president of the Wacomico. How do you pronounce that?
Wacomico
County Medical Society.
There
right?
you go.
You know, so you know, when we're coming up with all of these names, now these are names that you're familiar with, Dr. T, and I don't know why you didn't respond to me quicker, leaving me out there like that. Ladies and gentlemen, let me stop all these names and let me bring my friend up, Dr. Rene Desmiris. Hey, Dr. Desmiris, how you doing? Unmute.
And let me just say, while he's unmuting, that Dr. Rene, comes to us from the State Medical Society, MedChi, and Mayor, we've had the State Medical Society, MedChi members throughout the 4 years we've been doing this. We've had some representation. Absolutely. So I want to thank MedChi and Russ Cajun and Dr. Carol Ritter for bringing Rene back to us. Hey, Doc, how you doing?
Good. How are you? Can y'all hear me okay?
You're sounding loud and clear.
Loud and clear, man. How you doing?
Great. Thank you very much. And good evening to you all and to everyone who's participating in this program tonight. This is really very nice of you to invite me, and I couldn't be more excited.
One of the things that I wanted to talk to you about, I'm sure that you see firsthand how devastating the diagnosis is of people who are diagnosed with heart disease, and how difficult the family have to process that. So I want to talk a little bit about when we get a chance to, when you tell people they got heart disease, how do you do that? Because empathy is so important with physicians, and knowing how to frame issues is important. And we also recognize how you frame the issue determines who embraces the cause. So how do you tell somebody that you got a heart problem?
So the important thing, of course, is to make sure your conversation is at a level they can understand. That's the most important thing, maybe any kind of physician-patient communication, whether it's or the patient or their family. So you want to make sure you're talking at a level that they understand. So if I'm talking to another physician, I'm going to be talking at a different level than if I'm talking to someone who really doesn't know anything about cardiac disease. So that's the first thing you want to do. And then you take it from there, depending upon the diagnosis.
Right. Go ahead, Doctor.
If I could, Dr. Rene, sometimes the news you have to give is a warning, an amber light. If you do certain things, you can avoid things. But sometimes it's bad news. And for many African Americans and other minority groups in this country, when they finally show up to a specialist, sometimes it's very advanced. How do you tell news at that level?
So I want to make sure I understand your question. Do you want me to sort of go through what I would say to just anybody, or how do I sort of address with any? The first thing I want to make sure people do is they understand everything I'm talking about. So I want to bring them up to the knowledge I think they need to have. Okay. Because if they don't have that, base knowledge, then everything that comes out of my mouth after that, they're not going to fully understand. and that's just going to build anxiety for them. So the first thing you want to do is give as much information in a way that helps them become more empowered in what's
Okay.
going on. You really have to view this as a partnership, not as not that you're going to dictate to them or tell them what to do. It's
Right.
a partnership. It's a team sport.
Okay.
Right.
There is always a mismatch, regardless of what we do. There's always a mismatch of knowledge between the physician and the patient and the patient's family. Well, almost always. Obviously, if I'm talking to another cardiologist, that may not be the case. But outside of that, there's always going to be that mismatch of knowledge. And anytime you have a mismatch of knowledge, you also have a mismatch of power.
Okay.
You have to be
Wow.
very sensitive to make sure that you're not being dictatorial to a patient, and make sure that they are involved completely in their decisions. I'm sure Mr. Perry would have a lot to say about that type of thing. But the if you don't do that, you're gonna lose them, and they're going to be more fearful and anxious, and that's never a good thing.
Hmm.
And because the other thing that will happen is as soon as if you're not careful and you say something really bad to begin with, they're going to focus on that from the beginning. You don't want to
Okay.
withhold anything, but you almost want to just sort of build to it so that when you really start to get into the more stressful things, maybe the more bad news, that they are prepared for it from an information standpoint, and therefore from a power standpoint, and therefore they can engage with you and be activated themselves into their care. Whereas
Okay.
otherwise, human nature would dictate that they will, and everybody does this. It's normal to sort of shut down, in a sense, from what you're hearing because something really, really bad has been said, and you just can't get that out of your head.
Right.
So I find that information and patient engagement, improving the patient's health literacy from the beginning as much as necessary, so they can have a team discussion with you, is absolutely necessary. That's the first thing you must do. You have to put yourself in their shoes
Good. Good.
and understand where they're coming from, what their level of understanding is, and what their level of fear is. Some people are, pretty fearless, but some people are very anxious, and that's not a judgment of anybody. It's just
Right.
everybody comes maybe from a different place, and you have to also remember that there's other things going on in their lives that
Yes.
maybe they're maybe they just lost a parent, or maybe they just lost a spouse, or maybe they're having a problem with one of their children, or you name it. Maybe they just lost their job. So all that impacts upon how they're going to hear you and how they're going to approach what you're about to tell them.
Yeah, that's
Thank you.
powerful. That's
Yes.
powerful. Thank you so much. All right, well, let's bring up our next guest. Thank you so much, Dr. Dismaris. Appreciate that. That was very well said. Thank you. All right, let's go to our next person. He needs no introduction on the Cutting Edge Show, so I can almost just bring him up without thing. But he and I are both former police officers.
Yes.
Nationally recognized men's health advocate. This brother. Not only is he a barber and owns a barbershop, but he also owns a health clinic that he put in his barbershop.
Founder.
That founder, right? I mean, he's the founder. He thinks out of the box. In fact, I'll take that back. Aaron Perry threw the box away.
Yes.
he doesn't even think out of the box. He's another kind of brother. And again, just a dear friend and a long time team member from the Cutting Edge from the Cutting Edge Show. Ladies and gentlemen, please join me in welcoming our friend Aaron Perry. How you doing, man? Unmute.
I am
There you go.
good, actually. I'm really good. Thank you. Thank you. And Renee, that was an exceptional presentation. I'm looking forward to hearing more, for sure. But yeah, things are going well. I can't complain. Mayor, I gotta make one clarification.
Right.
I've been associated with the barber shops for so long, but I am not a barber.
Well,
Yeah.
I take that back. Okay. Well, let me say this:
It's all
you
good.
own the barbershop, right?
No, I own the men's health clinic inside the barber shop. Yeah.
Okay.
But I don't want
Okay.
to take
Okay.
that thunder for those guys because they work hard.
Well. I'm not a barber as well, but I do cut hair. so,
Yeah.
I just confer that upon you. That's one of those things that I conferred upon you when
It's
now
all
you
good.
have all the rights and privileges appertaining there too. I take that back.
Yeah.
It's okay.
Yes,
But
it's
but
all
but
good. Yeah.
but let's talk a little bit about uh how you got into this space, because
Yeah.
obviously, you know, there has to be some impetus. It has to be some something that happens, some charge,
Right.
some assignment, right? Tell us how you moved into this space, and what was the genesis of you developing a health clinic and putting it
Yeah,
in.
well, it really goes back to, and I think you mentioned it earlier. It goes back to when I was a cop, and I remember just repeatedly saying to our elected officials, we cannot arrest our way out of poverty.
Mhm.
Poverty is going to win. And so that is really what kind of started me on this trail. But it was having a seat in the barber shop and getting my hair cut. Of course, this is when I had hair. If I take this hat off, there ain't no hair under there. But when I had hair, I would sit in the barber's chair and I would get my hair cut. And I would just listen to a lot of the health challenges that men were coming in and talking about. I got gout, guys are coming in, I got that sugar last night. Doctor told me I got that sugar last night. And I'm hearing all of these things, and man, they would get that beautiful haircut and they would walk right out the door. And just over a period of months and maybe even years of hearing this, I ended up serving on a committee with the University of Wisconsin hospitals. So I served on the Wisconsin UW Hospital, the Diabetic Patient Advisory Committee, and the UW Hospital Patient Family Centered Care Committee. And so I served on that because I needed to know how are things going on behind the walls, because we're in the community and there seems to be a little bit of a disconnect, because at the time we started this, the average age of death for Black men in Dane County was 51 years of age.
Wow.
And, my thing is we got a top 10 university in our backyard. We have 4 billion, practically $1 billion hospitals in our backyard. There's a disconnect here. And so serving on those committees, I wanted to be a voice from the medical community back to the community that I represent. And so serving on that, I realized right away, part of getting the information out, we were just trying to reach people from the wrong location. And
Mm.
so I started to hear that, well, they schedule appointments, they show up too late, or they're no show at all. And I'm like, wait a minute, when they go to the barbershop, they schedule an appointment and they never miss. It's less than a 1% cancellation rate at the barbershop. So I'm like, we're trying to reach guys in the wrong location.
There you
And
go.
so, yeah, so I came up with this idea. Well, let's invite some of the physicians to come over and do the lunch and learns. And so we started doing that. They come over and break bread at the barbershop.
And what year?
And
Just
then,
give us a quick year,
yeah, that
circa.
was that was 2016.
All
You
right,
know?
keep going.
And so then we decided, okay, this is actually working. Guys are opening up and they're talking. I'm gonna knock a hole in this wall and I'm gonna put a health clinic there one day. And it took me about 7 months to do that, but we did it. And I tell you, the first year of opening the doors, we had 890 men come through.
There we go.
And yeah, I mean, they came in and they were, but again, remember I said at the top of top of the show, I'm a former cop, so I had to work through that trust building, not only just with talking about healthcare and the trust there, but I also came in with a whole nother a source of trauma for a lot of these guys. I was a former cop, and
Yeah.
so I had to be patient. I had to accept a little bit of, I don't want to call it abuse, but guys were, and it was trauma talking to me. It wasn't them. And so I had to accept that. But once we worked past there, guys started letting us come in and get that blood pressure. I was the king of, I'm get that
All
blood
right.
pressure today. They coming to get that haircut. Don't, you ain't leaving out of here until I get that blood pressure. And but what really got our attention, we had a gentleman that came in and tried to get his blood pressure for 6 months. And he was going on vacation. And I said, come on, man, I got to get that blood pressure before you go on vacation. He said, man, I don't want no bad news before I go. But when I come back, I'll let you get that blood pressure. So he came back and I was waiting for him, because I have access to the barber's books. So I know who's coming in the next day. So he's coming in and I'm waiting for him. And I said, come on, bro, let me get that blood pressure. And he was dug in. He said, man, just not today. I'm not feeling good. I said, okay, I respect that. Next time you come, we're going to get it. He walked out the door and he had a massive stroke and he passed away. And I said from that point that I would not let up ever again. I am going to figure out a hook because everyone can be hooked. I didn't hook him. And so we went back to the drawing board and I started looking at all the things that I could have did different. It wasn't just on me, but it was on the community that, family knew this man was sick. Friends knew this man was sick. But I came back to the table and said, we can do better. And that was really the source of me really pushing and opening up this men's health center in a barbershop, making sure that we did not any other men in that manner. And that's really what brought me to this.
Such a
Aaron, I just want to, it's so powerful. And I was there at your humble beginnings, just before you knocked a hole in the wall. And he had like a health education section of books and materials, again, integrated into the barbershop. So let's snap this, brother. It's all about the frontier. You knock down some walls, have some models that maybe could be replicated. And what a conversation we're going to have tonight.
Oh, yeah. Wow. Thanks so much, Aaron Perry, man. I miss you, guys. Absolutely. Good to have you join us.
Thank you.
Okay. Let's bring up our last and final guest. We got other people come with us. Dr. Ambreen Muhammad. She is a cardiologist at Heartbeat Health. And of course, one of the things that I was interested in knowing was about advanced imagery, non-invasive cardiologists, and what does that mean? Because obviously, if it's non-invasive, that always seems to be more appealing to me. So I say, whatever you doing, I like that. I like that, right? Right. The other thing that I recognize is that she not only practice cardiologist as a cardiologist, but she also talks about it.
There you go.
With a heart-to-heart show, and that's what we were talking about. Even as Dr. Desmiras was talking about, we have to be able to put it where people can understand it. I put it like this: we have to put it what do I say, Dr. T? We have to put it where the
goats and the cows can get it.
That's right. We have to put it where the goats and the cows can get it. And so that's what she does as well. I am so elated to bring forth a new friend.
There you go.
Sister from another mister, right?
Okay.
Dr. Ambreen Muhammad, bring her up. Hey, Dr. Muhammad, how you doing?
Hi, I'm so happy to be here. This is so exciting. Thanks for having me.
Good. Again, when you get into a space like you're in, let me thank you, because it is so important that we have people like you and others, Dr. Desmiras and Aaron Perry, to really focus on this issue of the heart. And I have come to realize that there is no facet of life that does not involve the heart. There's no part of your body that the heart does not have a direct influence over. And even your best self is always expressed by saying, it's the heart. She sang with all of her heart. He played with all of his heart. It's your best self, right? So it is a matter of the heart. And so thank you so much for your heart work.
I love the play on words. Yeah.
How did you get into this? I want to kind of know your story.
Yeah. So actually, I loved hearing both is it Dr. Desmarais or Dr. Damaris? I don't want to say
Desmarais.
Let him pronounce it. He's right there.
Yeah, let him pronounce it.
Actually, it's Damaris, but they go by both because it happens a lot. It's a difficult name to pronounce. So
Demarius.
Yeah. So
Yeah,
what?
Damaris, yeah.
Yeah. So what Dr. Damaris and Aaron, both of their stories, everybody has a story, and my story actually stemmed actually early on from my dad. My dad had a lot of heart and health issues as I was growing up. I always knew I wanted to be a physician. It's funny in my culture, everyone ends up being a doctor, lawyer, and engineer. And so my parents actually never really pushed me. My dad was actually upset when he found out that I wanted to go into medicine because he thought that I would make a better lawyer, probably because of the amount that I talk and argue. But yeah, and my mom is a PhD. She always wanted to go to medical school, but when she was young, she wasn't able to afford going to medical school. And so, for me, I always just had that like passion to help people. And I remember, when I was young, my dad had issues with like high blood pressure, and all of those things. And I never was really able to understand it, but I knew that, he wasn't always doing well. I knew he was taking a lot of medications. I knew, he'd go to the hospital sometimes. I knew that he would, be seeing his doctors all the time. And he was always just working hard and never really complained to us, but something just never felt right. And when I ended up going to medical school, I actually initially wanted to be a dermatologist, funny enough. And no hate on dermatologists. I love my dermatology colleagues because we all got to look good, right? But I realized as I was learning early on in medical school, all of like the cardiac, pathophysiology, all of the pharmacology, and just like the inner workings of the heart, I was like, wow, this is actually really interesting. It's not as complex as I thought. To be honest, I was like, I don't know if I'm smart enough to do this. And then as I was going through my rotations, I had a couple of really great mentors, one in the cath lab, and the cath lab is somewhere where patients go to have stents placed and to have angiograms. And, now in the, newer age, patients can even have valve procedures, without even having open heart surgery. Like we've just made so many advances in cardiac care. And so I had a really great mentor there that, showed me some of these procedures and what it was like. And I was like, wow, this is so cool. Like we can actually have literally a hand in helping people live, which is incredible. And then also I had a really great mentor in one of the clinics when I was like a third or fourth year medical student who just kind of sat with me every day and like just went over EKGs with me. And as boring as that sounds, like I was like, oh my gosh, I actually understand this, and like the heart, not only does it pump, but how does it pump? Like it pumps through electricity, and how does that happen? And these are all the changes that you can see on an EKG and all of the cool things that you can diagnose. And I was like, this is what I want to do. It was just like a light bulb. I was like, this is what I'm going to do. It was not an easy road. Okay. Getting into cardiology, and Dr. Damaris, I'm sure you know very well, it is not an easy road. It is not an easy fellowship to go into. It was very difficult for me, but I did it. And, especially being a female in the field and also being a minority, it is also not an easy feat. Less than 20% of cardiologists in this day and age are females that are board certified. And we're really actively, I'm on the leadership committee for the American College of Cardiology for Women in Cardiology. And, we're actively always trying to get, girls in medical school and then in residency to go into this, field, because it's so important, especially for women, to be able to help other women, to have minorities be able to help other minorities. I mean, we know, there's so many racial disparities that occur in this country. And I love, Aaron, the fact that you have opened up this clinic in a barbershop. Like, how amazing to be able to help people at the community level, which is where we need it. I recently, before I went to Heartbeat, I was actually working in a community-based clinic out in LA. I live in Southern California. And, I saw people every single day, from various socioeconomic backgrounds, on Medicare and Medi-Cal. And, it was so frustrating. I can't even tell you, to want to help them, and I'm getting denied left and right because I can't prescribe this medication. I can't order that test. We can't do this procedure. A lot of the patients had a lot of mistrust in the medical system, which, I'm sure you guys know very well, that, has run, in this country for such a long time. So to be able to build trust with my patients, to sit with them eye to eye, and just like, Dr. Damaris said, that, you have to build this relationship with them, that, you're telling them really scary things sometimes. And you want to be able to just hold their hand through the whole thing. It's not talking down to them. It's not, telling them that, this is what you have, here's your medications, and, I'll see you in 3 months. It's really holding their hand through the whole process, and trusting them, and saying, hey, we're a partnership. We're in this together. And I want to be able to help you. And I want to understand maybe why you can't take your medications, maybe why you can't eat, as healthy as I want you to, maybe why you can't exercise the way that I want you to, maybe, why, certain things are going on where you don't want to come to your doctor's appointments. You can't come to your doctor's appointments because you don't have transportation or whatever, issues at home. Like, there's so many things that sometimes I think we as physicians, which that's a whole nother conversation. And I feel like I'm kind of talking a lot here, but
No,
it
that's
is,
very important.
it is important for us to understand where the patient is coming from, so we can help them in the best way possible. So really, to answer your question in a really long-winded way, I really went into this to help people. It's just been a passion of mine. And I truly feel like I've found my passion, and I found my voice. And, luckily I'm still early in my career. So I hope to grow and help people more.
Mayor, from Dr. Muhammad's opening, Dr. Damaris, warm physicians willing to take the time to listen, to meet people where they are.
Mm-hmm.
But so many of our people don't run into those physicians.
Right.
And so as we have this conversation tonight, I'd like both cardiologists to say, how might the patient, what advice might we give them to be more empowered when they come before you, to be ready to be a partner, to become prepared to be a partner?
Right. Well, obviously that is an excellent segue into where we're moving now, because as Dr. Damaris talked about earlier, that there is a power dynamic that exists automatically, and what he tries to do is to reduce that by making everyone a part of the process, by making sure that they understand that they are an equal partner, if not greater, a partner in this process. And as you elicit that, many people, not all, will open up and will take ownership of their own health in ways that they may not have otherwise. But I think it's important. So Dr. T, was that a question? Because I was about to go into, I was about to ask the question to Dr.
I would say it's a question that will hang in the air like smoke as we have this conversation. What advice do you have
out there, right?
That's right. So that our people show up prepared to be partners. Aaron's enabling that early on. They're having certain conversations in the barbershop rather than in the emergency room. What other things might help them be better prepared to be partners?
Yeah.
Now, go ahead with your question, Mayor.
What I want to do is, we were talking, Dr. Damaris, Damaris.
Call me Renee.
Good. Okay. I got you, Damaris. Damaris. Okay. All right. Let me say this. We talked about putting it where the cows can get it, right?
Yeah.
Remember that? Right. Tell me, how does the heart work? It's in a simple way. I'm a fifth grader, right? Tell me how the heart works. How does the heart work?
Well, I'm really glad you gave me this opportunity to say this, because for all of our people that are taking part in this in the audience, I think it's important that we understand that not everybody has the same level of health literacy. So when you address anybody, you have to, as I said before, you have to get to their level. Well, if you have a large audience, then you have to have almost what's called universal precautions, where you have to assume that there might be someone there who has absolutely no knowledge whatsoever of the heart. And so I would like to begin that. So to answer your question, I'm going to be very basic here, and some of your audience may know a lot of this stuff, and I apologize if that's to them if I'm sort of wasting their time. But to start from the very basics, the heart is a pump, pure and simple. That's its function, right? To pump blood to the body. So to do that, it has 4 chambers, and it has 4 valves, an electrical system, and blood vessels that supply the heart itself with blood, so it can work. so there's, as I said, there's 4 chambers, and they each pump blood into the next chamber or into the lungs. And the valves are there. The 4 valves are there to allow blood to go through the heart in a circular fashion, a circulation fashion, and to then close, not let blood go back the wrong way. The 4 chambers, there's 2 on the top, 2 on the bottom. The 2 on the top are the atria, 2 on the bottom are the ventricles. There's a left and a right for each one, so it's sort of nice and symmetrical in that sense. There's 4 valves, and as I said, the valves should open freely and not let blood leak backwards, so that everything goes in one direction in a circle. Heart has an electrical system which controls its rhythm. And many diseases we have in cardiology have nothing to do with the plumbing, so to speak, the 4 chambers directly, but rather with the problem with the electrical system. The electrical system has a very distinct order that it should proceed with as the heart gets electrically charged. And then, of course, the heart has typically, most people have 3 major arteries that supply blood flow to the heart, and through those arteries goes oxygenated blood, which provides the heart with its own blood supply and is necessary for it to function, of course. So the right side of the heart will get blood from the body that has had the oxygen taken out of it. Oxygen is necessary for all tissues to live, and without enough oxygen, nothing works well. So after the blood's been used, after the oxygen has been used or taken out of the blood, it goes to the right side of the heart and then it gets pumped into the lungs. In the lungs, we breathe in air, we take oxygen in, and that gets attached to our blood cells and goes into the left side of the heart, where the left side of the heart will then pump the oxygenated blood, the blood with oxygen in it that is full of oxygen, to the body. And then the circle begins again. The blood goes around the body, comes back to the right side of the heart. That right side of the heart pumps into the lungs again, and so forth. And it goes around in a circular fashion as such. And again, the valves keep the blood going in the proper direction.
Yeah.
Wow.
That's putting it where the cows can get it, Dr. Demers. Go ahead, Dr. T. What were you going to say?
I was going to say, as he's talking, you get the visual image of a muscle, as it's pumping. And you were talking about matters of the heart, and we have it in romance. And there's a rhythm to the heart, and that rhythm is controlled by the electricity. And so I could see how you could get excited about learning about the one thing we must have working properly to live well. And the one thing that when it's messed up is a leading cause of death.
Right.
And we have so many different names for those heart-related diseases. And I'm hoping we can sort some of that out tonight.
Let's see if we can talk about the dis-ease of the heart. Dis-ease, right? Disease, right? Of the heart. Because that's anytime something does not go properly or flows, right? That's a dis-ease, right? In this disease. So let's talk about the things that happen when the heart does not work properly, Dr. Mohammed. You hear about stroke and other things that happen as a result of clots and things that may formulate in the heart and then go to other parts of the body. Talk a little bit about that and how that happens. And then I want to get into the conversation of something being congenital or derivative, whether or not you are born with being predisposed to these kinds of heart diseases or genetically, or is it diet or lack of exercise, or what brings about these things? So if you could help us first with understanding the different diseases and the different negative outcomes as a result of the heart not functioning properly, I would be grateful for that.
Yeah, so that's a really good question. And, heart disease is a really broad term, right? So it doesn't just, I think when people think of heart disease, they may think like, oh, it's just related to a heart attack. I've never had a heart attack. I don't have anything wrong with my heart, or I don't feel anything, nothing's wrong with my heart. But then, I may be seeing a patient in clinic and they're like, I'm fine. I don't have anything going on. I don't know. I was referred here. And then I'll take a look at their chart and they have like 5 things that are going on that are related to the heart. And I'm like, well, actually, so, so heart disease can fall into many different types of, categories. So it can be a pump issue. So there's heart failure. Okay. And even within heart failure, it's not necessarily that the pump is not working well. It could also be that the muscle has a hard time relaxing. So that's called diastolic dysfunction. There could be systolic dysfunction, which means the pump is actually failing. It's not working well. And there's different grades of that, like a mild, moderate, and severe. The way that we categorize heart failure in terms of how much blood is being ejected from the heart. So that's called an ejection fraction. So nobody has 100% ejection fraction, but normally you would want greater than around 55% of blood going out of the heart or greater. Usually we'll say greater than 50, greater than 55, greater than 60, greater than 65, something like that. Then we take a look at the circulatory system of the heart. So just like Dr. Damaris said, we have, plumbing, heart plumbing. So that means that there's arteries or vessels that actually sit on top of the heart, epicardially, meaning on top of the heart muscle. Those are called coronary arteries. And just like we have arteries everywhere else in our body, we have the aorta, we have different arteries all over, supplying basically every single cell in our body that kind of branches out. We have arteries that supply our head, our neck, et cetera, et cetera. We have arteries that also supply the muscle of the heart. And that makes sense, right? Because the heart is a muscle just like any other muscle in our body. And in order for that heart to pump and work, it needs oxygenated blood to do that. And how does it get oxygenated blood? From the vessels that supply that muscle, and those are the coronary arteries. And so just like Dr. Damaris said, we have 3 main coronary arteries that supply different parts of the heart muscle, and they branch off so that each part of that muscle and all of those cells are covered. And then what can happen is that just like somebody can have a stroke, right, from a blocked vessel, in simple terms, somebody can have a heart attack from a blocked artery. Okay. And so that occurs when that blockage actually ruptures, and that can cause a heart attack. And so that's the plumbing. And then another type of heart disease can be from some kind of electrical failure. Not electrical failure, we call it an arrhythmia. So, you can have various types of arrhythmias that originate from the top portion of the heart. So the atria, like we had heard about before, the 2 top chambers, or the bottom chambers of the heart, ventricular arrhythmias, which can actually be much more deadly. You can have, arrhythmias or heart rhythm issues that occur because how the electrical system works is that it starts at the top right part called the sinus node. So I'm sure a lot of you guys have heard of a sinus rhythm. That's a normal rhythm that we all have. That's because the electricity starts at the sinus node and then travels through the heart. So if any of the nodes in the heart are not functioning properly, that can also cause a rhythm issue, and that can lead to things like pacemakers that patients might need, especially as patients get older. You hear a lot of people get pacemakers. Like my dad has a pacemaker, so that's very common. And so those are like the 3 main, things. You can have heart failure for various reasons. You can have a heart attack because there's a circulatory issue or, an issue with the plumbing. You can have rhythm issues because the electrical function of the heart is not working okay. Dr. Damaris mentioned the valves. We have 4 main valves of the heart. So if some of those valves are not opening or closing okay, so let's say the valve is kind of stuck and it's not opening okay, or if the valve is just when it's supposed to be closed and blood's not supposed to be going through, it's kind of like, kind of flippity floppity, and it's like staying open.
Mm-hmm.
That can also lead to heart disease or heart failure. And so, when we're assessing patients, whether it's in the office or if we see you, in clinic, I'm sure even at the level, the community level, like, for primary care colleagues or, assessing patients and, in their clinics or even in your barbershop, which is incredible. They're going to have, they might have various symptoms and Dr. Damaris, I'm sure, obviously he knows this very well. Like you can just come in with, very simple symptoms. Oh, I have chest pain. Oh man, I'm feeling really tired. My breathing hasn't been, like I thought it would be, or, like it used to be, or, when I sleep at night, sometimes I wake up, they're starting to get bigger, they're getting swollen, and that's never happened to me before. I used to be able to walk 3 blocks and I just can't do that anymore. Or, I passed out a couple of times and I don't know what that's about. Like, they come in with symptoms like that. So it's kind of our job, because a lot of these symptoms are vague, right? Like it could be related to a lot of things. So it's kind of our job to start to narrow down by asking people questions. Okay, well, what does your chest pain feel like? Or, tell me a little bit more about your breathing. Does it just occur like, can you just not exercise? Or is it also occurring when you're just kind of sitting watching TV at home? Or, tell me a little bit more about your swollen legs, or tell me a little bit more about how long this breathing issue has happened, or how many times did you pass out? Or, how often are you getting dizzy? Things like that, so that we can start to narrow down like, okay, I may think it's this or that. And then we use additional testing. So things like an EKG, which is basically like I tell patients, it's like taking a picture of your electrical system. It's like a moment in time where I'm able to see a picture of your electrical system and I can see what's going on there. It doesn't tell me what happened 5 days ago. Well, it possibly could, but 5 days ago versus what's going to happen 3 months from now. But I can at least, in a snippet of time, be able to see what's going on with your electrical system. Or maybe I want to get an ultrasound of your heart. I want to, take some pictures of your heart and look at it in different ways. And that's kind of my specialty, the advanced imaging that you mentioned earlier. That's kind of what I specialize in, is looking at the heart in different chambers with different imaging modalities, to be able to see like, okay, well, what does the pump function look like? How are the valves opening and closing? Like, how thick are the walls? Like, things like that. And then, maybe even sending them for a stress test. Like if I'm concerned that their chest pain is kind of out of the ordinary, and they have a lot of risk factors, which I'm sure we'll get into, risk factors for heart disease, like high blood pressure and cholesterol and diabetes. Like maybe I need to send them for a stress test to see what's going on. So, kind of taking the information that we have, using the tools in our tool belt to be able to lead us towards a certain, diagnosis, so that we can ultimately help people, because that's the whole point.
Mayor, we've had like a master class here, and I'm just imagining what it means for folk in the barbershop to have this level of conversation, so that when they go in and they're interacting with a healthcare professional, they've got some good background to be a partner. Hey, Aaron, your people are hearing about some of this technology in the shops, right?
Yes. Thank you for that presentation from both of the physicians. I'm blown away. Some of this we hear and we see. So next Thursday, our nursing students are going to complete their internship. So they do an 8-week internship with us. And so next Thursday, they do their 8-week aggregate report on what they've uncovered since their internship. And I was just notified today that the data for high blood pressure hasn't changed. So 3 years going back, 82%, 84%, last year, 87%. And I was informed today that the numbers are not a whole lot different. And so even though we are brand physicians to the barbershop, we're exposing our men, we're still not hitting the target. And what I do know, based on the information from the University of Madison School of Public Health, 48% of all Black women and 46% of all Black men has some form of heart disease in the United States. I was not aware of that. And that is very consistent with the numbers that we see when the students are doing that aggregate reports, and so we're going to continue to push forward. One of the things that we do is that we have this thing that we coined: whenever your check engine light come on, that's always the time for Black men in our community to go and get a stress test.
There you go.
Every time that check engine light comes on, we need our men to schedule a stress test. It's starting to catch on. A lot of guys are posting, whatever they are comfortable sharing. But anytime our car check engine light comes on, we now know in our community it's time to get a stress test, regardless of what's going on. And so we're going to keep these little things that we try to do to try to fix or reduce these extreme numbers that are coming back on this hypertension.
That's great. We call that cultural tailoring.
Absolutely. What we're going to do is we're going to tailor something. I want to ask the question, and then Dr. T, we're going to go into the red crowd. Dr. Ritter, get ready, and Sandra Jenkins and Dorothy Reynolds, get ready. I'm going to bring you all into the conversation as well. I've heard so much about AFib.
There we go.
Right? Could you help me, Dr. Damiris? Tell me, what is AFib and why is it so prevalent? Because I'm hearing so much about that.
So let's go back to the discussion about the electrical system. As Dr. Muhammad said, there's something called the sinus nodes at the top right of the heart, which is the heart's natural pacemaker. And so when that fires off automatically, without us thinking about it, normally 60 to 100 times a second, and then that electrical signal passes through the heart. The entire heart is an electrical organ. Every part of the heart can conduct electricity. So once that charge goes off from the sinus node, it spreads through the top two chambers of the heart, the atria, and then it collects in the middle in another node, as Dr. Muhammad said, and then that node allows the electrical signal to go through and then pass to the bottom chambers, the ventricles, and they fire and they squeeze. With atrial fibrillation, the natural pacemaker, again, that sinus node, is no longer keeping the rhythm. Think of the sinus node as the band leader, the conductor. When the conductor is working, the rhythm is regular, like a clock ticking. When that structure no longer controls, when the sinus node, the conductor, no longer controls the rhythm, then all the musicians in the atria, the top two chambers of the heart, decide to do their own thing. And chaos.
So they play some jazz then. They go into jazz. But okay, I'm sorry. I digress. Go ahead. Go continue.
It's not chaos. Jazz is jazz. This is
more
chaos.
like heavy metal music. It's crazy. It's circulating. It's going all over the place.
It's like the tune-up. It's like when they're tuning up.
Go
it has no rhythm whatsoever. It's entirely chaotic. You cannot determine when one beat's going to follow the next. And 300 to 600 electrical impulses are bombarding that middle part of the heart every minute. Now, they don't all get through, but that's a discussion for another time. But when that is going on in the top chambers of the heart is no longer, the top chambers are no longer squeezing. They're fibrillating. That's atrial fibrillation. They're just quivering. And the reason that's so bad is for two reasons. One, the atria pump blood into the bottom chambers, the ventricles, to prime those pumps, to make them work better. So if you're in atrial fibrillation, you can lose 25% of your heart's output. Remember, the heart's a pump. Simple as that, at the very basic. So it loses 25%, can lose up to 25% of its output. And so that can make people feel tired. It can cause heart failure. And the other thing that has happened, because those chambers are just quivering and fibrillating, blood is stagnating. Anytime blood stagnates, it forms clots.
Wow.
Now we want clots to form when we cut ourselves, but we don't want clots to form inside our blood vessels or our heart, because of course when they do, they can break loose and travel to other parts of the body. They can go anywhere in the body, but most mischief is caused when they go to the brain. And when the clot breaks loose from inside the heart, travels to the brain and closes up a blood vessel, as Dr. Muhammad said, every part of the body needs blood supply. That the brain downstream from that blockage starts to die, and that's a stroke. So just one thing about heart failure, if I may add, I tend to look at heart failure.
Oh no! This is. I hope he comes back. just as he was getting
Yeah.
ready to say the, and I'm in this like
Right.
like wow,
Left us
you
in
know
suspense,
why
but it's
why
We're on the
why?
edge
What
of our
happened?
seats.
Stop. Come
All
on.
right, he's
Okay,
back.
you back. Go ahead.
Heart
Continue.
failure, boom.
The heart is back. Okay, good.
So I just want to say something about the way I look at so just a little education piece for our listeners is that I think of heart failure as increased pressure in the heart, regardless of cause, whether it's a valve problem or a systolic problem or a diastolic problem, regardless, it's high pressure. So, and people can get their head around that usually because it's a pump, and they understand that if a pump has too high a pressure, it's not going to work too well. So when the heart has too much pressure inside, the pressure is too high, then the pressure backs up into other systems. When it backs up into the lungs, it makes fluid leak into the lungs. That makes you short of breath. When it backs up into the belly and into the legs, it causes belly swelling and leg swelling. So those are all signs of heart failure. So shortness of breath, belly swelling, and leg swelling are all signs of heart failure, regardless of cause.
Wow.
All right. Dr. T, I know we're gonna do this, but I got one more question for Dr. Muhammad. I got it. I got to get these questions in. When you're talking about taking your blood pressure, right? What's good, what's bad, why is it good, why is it bad, what numbers should we be looking for?
Yeah, so that's a really important question, and I think especially at the community level, like at Aaron's clinic, these are really important discussions to have because a lot of patients I feel like are not as aware, or for some reason are having difficulty controlling their pressures for many different reasons. And the other thing that he mentioned is the racial disparity. I mean, in Black and brown populations, especially in Black populations, hypertension is, one of the leading things that's occurring. I think I remember like reading a statistic recently from AHA where, 58% of Black women greater than the age of 20 have a diagnosis of hypertension. I mean, that's bananas, over the age of 20, and it's one of the risk factors for heart disease. So to answer your question, the way that we classify heart disease now is in stages. So we look at heart disease as a stage 1, stage 2, or pre-hypertension. So I'm sure, some of you have heard, the magic number 120 over 80, right? So 120 is the systolic, it's the top number, and 80 is the diastolic, it's the bottom number. So when we're checking our blood pressure, we look at it in that way. So, we look at it in a top and a bottom number. Now, over the years, I feel like the societies and guidelines have really become a lot more stricter with blood pressure control because, again, we see how, impactful blood pressure could be on our body in a bad way, especially if it's high. And so stage 1 hypertension. So when someone is diagnosed with hypertension, that's usually a number greater than 130 over 80. The bottom number being greater than 130, the top number being greater than 130, the bottom number, the top number being greater than 130 and the bottom number being greater than 80. And stage 2 hypertension is any number greater than 140 over 90.
Wow.
Okay. But really the key is pre-hypertension.
There you
right?
go.
If your number is less than 130 over 80, it doesn't mean I'm good. I don't have to do anything. Let me go to McDonald's tomorrow. No. Okay.
Mm-hmm.
Pre-hypertension is 120 to 129 over 80 to 89. So we really want that number to be lower, not so low that you're like, dropping over like a fly because your blood pressure is so low, but we want your blood pressure to be well controlled.
Yes.
And so we really want people to know their numbers. If somebody has high blood pressure and they're taking medication, I want to target their numbers to be less than 130 over 80. But just because they don't have a diagnosis of hypertension and they're not taking medication, even if their numbers are a little bit elevated with the numbers that I mentioned, I'm still hitting hard with you got to be good about your diet. You got to be good about your exercise. What can we do to try to drive these numbers down?
Wow.
Wow.
Okay. We're gonna
All
do.
right, man.
We're gonna do something. What we're gonna do is let's do the let's get a pulse,
That's right.
if you will.
Let's get a poll.
Let's get a pulse, and what we'll do is we'll do the word cloud, and Dr. T tee it up.
So this will just take a second. Think of a word that best reflects how you're feeling right now at this moment in the new normal of our post-pandemic? We've asked that question throughout this entire 4 years, and it lets us know what's going on. Think of that word, drop it in the chat. Now, for the next 60 seconds, drop as many words as you can think of. And for those of you out in social media land, you can use the Q&A box. And we can keep this conversation going as you just drop those words in, and the crew behind the scenes is going to build a cloud. And that will set the table for you to meet our wellness warriors that are out there as part of this effort.
So you do that,
community.
and if they could bring up Dr. Ritter, and so we can engage her in the conversation
That's right.
as we get ready to move forward. Dr. Ritter, how are you doing today?
I am doing well. I am in my office, so I've been here all day, and I've never used the Zoom before, so I hope it's working.
It's doing very well. It's doing very well. Dr. Ritter is our resident gynecologist. She's been with us for
That's right.
For how long I don't know, but since we've been doing this with
I have
very
never
few
met you, Mayor.
Right. That's right.
Mayor
That's
Neal, I
right.
have never met you.
You know, spirits
Personally.
don't meet, spirits
I
reacquaint.
have never
Always
met you
remember that.
either, but hopefully I will. Being in Wisconsin, I am.
Yeah, but we've
Someday
been it's been years. Let me say this.
That's
that
right.
Dr. Ritter has been with us.
Yeah, beginning of the pandemic, 3 years probably.
Right. So you know, you deal with women from your perspective. How does the heart impact gynecology in your area?
Well, that's interesting that you ask because it hasn't been studied yet. There's not enough evidence to suggest that there's any problem there, except the evidence is starting to come out that there's a problem, that women are dying of heart disease more than they should in labor, pregnancy, in their 40s. And the USPS task force doesn't even recommend that we get our lipids checked before the age of 45. You know what the USPS task force is? United States Preventive Service Task Force. And they give guidelines for how we should check lipids, which are like the #1 cause of coronary artery disease, right? Doctors, the other cardiologists here, maybe not the #1 cause. But interestingly enough, my dad had coronary artery disease. And I remember him coming home ashen with his first heart attack when I was in high school. And I remember my mother yelling at him, "Jerry, if you die on me, I'm going to kill you. If you leave me with these 10 kids." So she nagged him. He went to the doctor, but I don't remember exactly what happened, but he stayed alive. And when I was in medical school at the Medical College of Wisconsin, I actually picked his cardiologist, and I went into the operating room to make sure this guy was able to operate. And I remember the cardiac surgeon looking at me as the heart's beating there, and looks up at me at the anesthesia screen, and he says, "This is a uterus," because he knew I was studying gynecology at the time. So he was a jokester, and I thought, okay, he's going to be a good he's going to do good for my dad. But anyway, it just showed me that preventive care can actually work, because I saw his angiogram and it was just a bunch of collaterals. Everything was clotted off. But he survived with preventive care before he had his bypass surgery, with diet, exercise, and a loved one who nagged him to stay on it.
Thank you, all the naggers out there.
Right. You know that. Thank you, Dr. Ritter. Dr. Carol Ritter has been with
One
us.
other thing I just want to say,
Go ahead.
just to finish this, is that my mother. So I always thought my dad was going to die before my mom, but she had breast cancer, so it was one or the other was going to get him. But I realize now that there are 300,000 women die of heart disease every year, and 30,000 women die of breast cancer every year. And we focus a lot on breast with women, but we don't focus much on the heart with women. So I think that's changing, but there's a lot that needs to be done to change it more.
You're
If
right.
I could, Mayor, ask Dr. Ritter a question
Mm-hmm.
as it relates to heart disease. There's this thing called preeclampsia. And someone said to me, oh, preeclampsia is a form of hypertension. Can you help straighten me out? What is preeclampsia?
Yeah, preeclampsia is hypertension in pregnancy, and it's a different stage because it's affected the liver and the platelets and everything else that goes along with that pump. But yeah, that is really a disease that I feel should have had a solution to by now. We do have, but we don't check the women before they're pregnant to try to prevent it. So it's once they're pregnant, they develop heart disease. Well, they've had heart disease prior. It's just exacerbated by pregnancy. When you have 5 times more blood in your body pumping through that pump while you're pregnant, that's a huge stress on your heart.
Mm.
And we don't even, don't let me go there with the USPS task force.
Well, the fact of the matter is we have physicians helping the community know how to better advocate for what we know can work. We're hearing this term pre-hypertension. Wow. So there's something I can do before I actually get diagnosed with the chronic disease. Let's get that information to our communities.
Right. One of the things I want to talk about now, and Dr. Damaris and Dr. Muhammad, I want you all to help me, and also Aaron Perry. How much does diet and exercise? I heard where Dr. Ritter was talking about diet and exercise. How much does that attribute to heart disease? Either can start. It doesn't matter. But I want to have this conversation because people talk about, I'm gonna die from something, so I might as well like what I eat, or whatever. How much is it over exaggerated about what you eat, and it's a contribution to heart disease?
So
one can do diet, one can do exercise. I'm sorry.
Yeah. So it's not over exaggerated. I mean, it's in our preventative guidelines. So the American College of Cardiology and American Heart Association have preventative guidelines, and a majority of that is, talking about, diet, exercise, and some of the other things that you can do for, prevention, like alcohol cessation, smoking cessation, things of
But
that
cessation, what's that mean? Stopping?
Cessation means stop.
Oh, okay. Yeah. I just want to make sure.
Unfortunately, a lot of these bad habits just need to stop. But listen, I love a good steak too, but you can't eat it all the time,
There you go. Moderation. Yeah.
So it impacts, and I'm sure Dr. Damaris, can say his words too, and knows very well with this, that, it's all about prevention. We don't want to see people in the hospital. I don't want to see you in the hospital. I don't want to see you in the lab. I don't want to see you with any type of issue. We have to start with prevention. And that's why where Aaron is doing his, community-based clinic, that's where it starts. So educating people on the type of diet to have. So what's considered the heart healthy diet recommended by the American Heart Association is a Mediterranean diet. So I always tell people it's not Mediterranean food, not like the good kebabs that you get, at that really nice, Middle Eastern restaurant down the street. Although that stuff is very good, it is not always good for you.
Right.
But this is a Mediterranean diet. So something that's high in protein wise, fish, a little bit of chicken, lots of good vegetables, lots of good fruits, a little bit of cheese, a little bit of dairy. Things that are high in grains. So quinoa, whole wheat, lentils, beans, nuts, taking away the bad oils, like the canolas and the vegetables, and substituting with a high grade, extra virgin olive oil or neutral oils like avocado oil, sometimes even a coconut oil, and taking away the trans fats, the saturated fats, basically all of that carby bad stuff, like the cakes and the pies and all this stuff that we're going to be eating around the holidays, taking all of that stuff
you
out.
Messing folk up. We just had
I know I am. I'm messing myself up too. I got it. And then even processed foods, right? So, I know, like, just like I said, when I was, working at the clinic out in LA and hearing about the types of foods that, patients were getting. I mean, a lot of patients are going to the frozen food aisle and they're getting the cans off of the shelves and they don't realize like how much sodium and processed stuff is in those foods. And so even just educating them on, hey, just any type of package that you pick up off the shelf, or when you go to a frozen food aisle, anything that you pick up, look at the ingredients, look at how much sodium is in there, look at the preservatives, because that's the stuff that's not going to be good for you. And unfortunately, again, given that we have a lot of, disparities in this country, we see that going to Whole Foods and getting the healthier foods, right? Like Whole Foods, the chain, you have to pay like 10 times the price rather than, going to the superfoods down the street where they're, you can get like, canned food or stuff from the frozen food aisle, always on discount, and that's less. But unfortunately, those foods aren't always going to be as healthy for you. So really just educating patients on, hey, even if you don't have access to the best foods, you can still get good food. You just have to be aware of like what you're actually putting into your body. And then the other thing also is it's really easy to, go to all of the fast food places. And, trust me, I love a good, Taco Bell every now and then, McDonald's, whatever.
You're telling on yourself.
But I know I'm going to be real here, but, telling people that isn't going to be good for you because that's all processed, junk, high in salt and all of that stuff that's just ultimately going to contribute to something bad if you're going to continue to eat it. And then the other thing is exercise. We want you to be able to move your body. We know that you don't have to do like you hear like the 10,000 steps a day. You don't have to do 10,000 steps a day. Even if you can get up to like 6,000, 7,000 steps, that actually can be super beneficial for you and ultimately decrease your risk of developing heart disease in the future. We want you to move your body. If you're able to take a walk outside with your dog, do that and try to do it for 30 minutes a day at an average of 5 days a week. So we say around 150 minutes of moderate intensity, which means something like walking a week. Or if you're like into running or swimming or jogging or biking or, Taekwondo, I don't know, whatever people are into, that's like high intensity stuff, 75 minutes a week. And so doing either or, trying to incorporate a little bit of resistance training. So like some weightlifting, things like that. And then trying to do that throughout the week so that you can pair your diet and your exercise, because ultimately we want your body to be strong, function well, so that we can lower your cholesterol and lower your blood pressure, because those are risk factors that will lead to heart disease.
Mayor, yeah, I'm telling you, what a show, because we're giving people the actual tips that they can take. And Dr. Renee, when it comes to some of these symptoms, there's so many people have described that they're seeing before the person actually ends up in front of a physician. Are there symptoms that are different between men and women?
Yeah, that's absolutely true. That women don't always experience the same symptoms as men, and that's very tricky business. Now, I will say that decrease in exercise tolerance, decrease in what you can do with exercise, I see that in women as well as men to a great deal. And so that might be, in my view, at least my experience the last 30 years, somewhat of an equalizer. So it's always a very important thing to consider is exercise tolerance. But yes, women don't have chest discomfort typically as men do. So I think it's always better for them to err on the side of being evaluated. But it's just not the other way to get around it. They just have to be more aware that they might not feel the same thing. So shortness of breath will occur more, in my experience, than chest discomfort in women. Decreased exercise tolerance, maybe more palpitations where their hearts, they feel the heart beating funny in their chest. Leg swelling is something we see in women that we may not see. That might be a clue. So these are all the symptoms we watch out for. Just to touch on the exercise stuff, all the stuff that Dr. Muhammad mentioned is all excellent exercise, but just doing yard work vigorously, raking leaves, for example, for 30 minutes, or anything else you do, that all counts. It's all good. So all that is good exercise. And the other thing to remember about exercise is that if you do it, the chance of having a heart attack is less. The size of the heart attack will be less. The chance of dying from the heart attack will be less.
Right.
In regards to diet, one thing that, and this is more in Mr. Perry's realm in a sense, is the problem with food deserts in the country. It is
Right.
not always very easy for some people in this country to get healthy food. There is a challenge there. They may not have the ability to get to a grocery store that sells healthy food at a reasonable rate, a reasonable price. That still exists in this country, and so I don't have the answer to that completely, because that's a national issue really, but that's something that patients need to try to correct if they can. But that's something that really needs to almost go to the government, the local government, to try to improve that for them.
Let me just say this, Renee, and Aaron, I know you want to respond, but what was so important in what you said from where I'm sitting is that you as a physician are saying it, that you're addressing a social determinant of health, that message has gotten to the level of, the medical societies, because your voice matters in recognizing that sometimes the populations cannot act on the very positive message that we need. And Aaron, right there on the front line, can do the work of getting the community ready to be advocates, as well as the medical society.
Good.
Go ahead, Renee.
I just said, well, and along the same lines, it's not always easy for patients to be able to exercise. There's places in this country where it's very difficult to go out and safely exercise. If you live in a neighborhood that's not the safest, you might be afraid to go out of your house or your home to go for walks. These are issues which are bigger than this discussion today, this show. But I think it's important to recognize that in our patients, that they may not be able to do those things that you want them to do. Somebody just have to exercise inside their own home and do jumping jacks or sit-ups or what have you.
The 7-minute workout.
Yeah. I mean, and that's what they have to do. So.
Renee, what you will love if you go by Aaron's place is that he's got treadmills in the clinic. He's got yoga mats.
That's awesome. That's fantastic.
It's a new doorway to access care.
That's awesome.
Aaron, go ahead. I know you're about to say something, and you can bring up the word cloud in the background as Aaron.
We're gonna make the workout the last thing we do. Let's just make that. We're gonna end with the word cloud. Okay, go ahead.
Thank you, guys. What I can say, I don't know if you can see this hat that says Black Men Run. So I'm the national director. It's a volunteer position, but a national director of health, wellness, and disease prevention for Black Men Run. So we have 52 chapters across 29 different states. And what I can tell you is, being in Wisconsin and hearing the stories of our brothers in the South, what we're trying to do now is we're trying to have a unified voice and a unified message nationwide. Because when our brothers in the South are struggling, we're up here in the North, we should be able to extend the hand and lift them up. So we got to get better at that. And so that's really one of the things that we're really pushing. But one thing that we have been encouraging our guys to do, particularly those that have, started a nonprofit, we're saying, quit asking health systems for money. They're just not going to give it to you. But this is what you asked them for. And so right now, we don't get a lot of money from health systems, but the services that we get are vital. We get imaging up to $20,000 in imaging every year. We get up to $20,000 in labs, and so they keep track of it. But we send guys over there to get their imaging done. We send them over to get their labs and then their X-rays. To us, it's a great trade-off because we just got tired of hearing no. And so now we're saying, okay, instead of asking for money, just give us these services. And it's actually starting to work very well. But we incorporate that every Saturday. We do a Black Men Run group. We do a Black Men Hike. in the Black Men's Psychomedicine. And so
Wow.
guys say, I no longer run or walk, but I love riding my bike.
There
So
we
we
go.
started this based on what these men stated that they needed. And the last thing that I wanted to share, the guy who leads our walks, every Saturday, he leads an 8-mile walk. His name is Fred Conley, retired police officer. He's 72 years old, and he leads our 8-mile walks. This guy's phenomenal. Right now, he's traveling the country as Black Santa Claus because he has this beard. So he gets to travel around and be Black Santa Claus. But this is some of the things that we're doing to try to
Amazing.
keep our men healthy.
Yeah.
Amazing.
I want to talk a little bit about this as a contributor to heart disease, and that's obesity. That's something that we don't talk enough about. As we talk about the food deserts and people living off of fast food restaurants, oftentimes their body mass increase as a result of that. So let's talk about the contributing factor of obesity to heart disease. Is there a correlation or causation?
Well, absolutely there is. And the other thing to recall is that there's also a relationship between obesity and cancer, and that cardiac disease and cancer share just about every risk factor. So when you're decreasing your cardiac risk, you'll also be decreasing your cancer risk. That's something that's not well known. So yes, obesity is a huge factor. But it's related to diabetes, of course, high blood pressure, and also one other thing. There's just a few things I've been jotting down. If I have just a few minutes to sort of go through it quickly, some quick tips about the risk factors and how to sort of prepare for your visit. That's as you asked before, and that's this. If I may, in terms of blood pressure, how can you prepare for your visit? Well, the best way to manage your blood pressure is with home blood pressure monitoring, not what you get in the doctor's office, but at home. And so if you can get a good cuff and get it calibrated at your doctor's office, bring your cuff to your doctor's office so that they can make sure it's accurate. And then do your blood pressure at home. Do it on a daily basis. Make sure your blood pressure is okay and reaches the parameters that Dr. Muhammad said. That's something that most people can afford, a blood pressure cuff. I know not everybody can, but most people can. Always make sure you do your home blood pressure monitoring, that you do it on a bare arm after relaxing for at least 5 minutes, and keep a diary so that you can bring that diary with you and your blood pressure cuff to your doctor's office or to Mr. Perry.
There you go. Now you're a partner.
Yeah.
Right. That's patient engagement right there. They are taking control of their blood pressure. It becomes a team sport. Get blood pressure, and you can do this stuff, and you can manage blood pressure over the phone with these patients because they have this at home. So if they're having trouble with their blood pressure, they call in. I do this all the time in my office. They call in and say, "Hey, my blood pressure is doing this, blah blah blah. What can I do?" Start doing this, doing that, whatever. The other thing about blood pressure medicines, it's not well known. If your blood pressure is not under control, you want to ask your doctor about this. How about taking my blood pressure medicine at night? That's been shown to be a better way to take blood pressure medicines, number one. Number two, do I have sleep apnea? Sleep apnea is where our airway closes when we're trying to sleep. It's related to obesity, but it doesn't have to be secondary to obesity. But sleep apnea is possibly the most underdiagnosed significant disease we have in our country right now, in my view.
Wow.
And because it can cause high blood pressure, it can cause you to gain weight. If you have identical twins eating the identical diets and doing the identical activity, the identical twin with sleep apnea will weigh more than the identical twin without sleep apnea because of central nervous system effects of the sleep apnea. So that's a very, very important thing to ask your doctor. If you're having high blood pressure, it's difficult to control, and you're waking up tired every morning, maybe you have sleep apnea. So that's around high blood pressure. There's a myth out there that alcohol is beneficial in small quantities, or that wine is good for you. That's just baloney.
Isn't that part of the Mediterranean diet?
Well, we don't remember all this stuff around wine was all epidemiological data.
That's right.
There's antioxidants in grapes, grape juice, right? So that's the theory. So really, no alcohol, no amount of alcohol is actually good for you. Just to debunk that.
Hold up. Now they did say that beer made you smarter, right? That's what I've heard. You know, will it made Budweiser?
Oh boy. Now we're really off the road.
No, we in the barbershop. That's where we are.
Okay.
Sure.
Okay, I digress. Go ahead.
A couple more things, if I may. Okay, so that's a big thing. And the other thing is, I like to. I trust me, I don't have any stock in this company, but there's a product called Zyn, Z-Y-N. I don't know if anybody's heard about that. That's in the panel. Z-Y-N is a nicotine pouch. It is my patient's favorite nicotine delivery system to replace cigarettes. So people don't like, and we haven't talked about smoking really much at all, but it's obviously very important. People have tried nicotine gum and they don't like it. Nicotine lozenges, they don't like it. I never use the patch because I don't think that's a very good way to deliver it. But Zyn, Z-Y-N pouches, nicotine pouches, my patients by and large love that stuff as a nicotine replacement. Don't forget that we have to get people off of cigarettes too. That is a horrible actor, and we haven't talked about that tonight. So in terms of prevention, and so just a little bit more on how to prepare for your visit. Make sure you have all your medicines with you. Brown bag your medicines. Put all your medicines in a bag so we make sure that what we think you're taking, you are actually taking, because a lot of times that's not the case. So put all the medicines in a bag and take them to your doctor. Get a blood pressure cuff and do as I talked about before. Write your questions down before you go, so you don't forget anything. Because remember, we talked about that power mismatch before, right? You get in a doctor's office, a lot of patients get a little intimidated and they'll forget what they're thinking about, or the doctor will start talking about this or talking about that, and they'll get off the track. If they don't have those questions written down, they will forget to ask them. And if they've taken the time to think about them and write them down, then they will be engaged and activated that way as well, right? And so
now, what about all the vitamins that people take? Should they take the medications and their vitamins?
Point. That's a fantastic point. Thank you for bringing that up. Supplements, well over 100 million people, maybe more now, take supplements, and those can interact with drugs and have other effects. And this is largely a product of a law that was passed in the 1990s to increase the ability for supplements to get on the drugstore shelves without really robust FDA oversight. And a lot of those supplements can be actually very dangerous. So yes, thank you for that. You should bring those as well, and make sure you mention those as well when you brown bag it.
Okay. All right. Let me do this. We got some people on. Thank you so much. Thank you.
And let's pull up the cloud. But absolutely.
Now, what I'm going to do is let me just introduce our people, and then I'm going to do the cloud. The last thing is that.
Okay. That works. All right.
Dorothy Reynolds. Let's bring her up and let's introduce her to everybody. We got 4 minutes.
Wow.
You know how this thing goes. Dorothy Reynolds in
Pine Bluff,
Arkansas. How you doing? Tell us a little bit about your reflection on what we talked about today. But we short today.
Hello, everyone, and I really thoroughly enjoyed the show tonight. I wish we had more time. And Aaron, I need to talk to you.
Okay.
Because I've got space. I really appreciate the information and knowledge that you all gave the doctors, Dr. Renee and Dr. Mohammed, that you gave to us, because actually we are all probably experiencing clients with those situations that you talked about tonight.
Thank you so much, Ms. Reynolds. Let's bring up Sandra Jenkins. Let's go out to the Philly area.
Philly?
Yeah, absolutely. You're all doing real good in the sports space. Okay, go ahead. Continue.
Don't get her started now.
I'm not going to get her started. Go ahead.
Well, thank you so very much. It was such a wonderful, informed discussion tonight. And I'd like to echo what Dorothy said, that, incorporating these discussions in our salons, in these conversations, we can go beyond just purely cosmetic concerns and demonstrate that we truly, genuinely care about our clients' overall well-being. So I thank you so very much.
Thank you so much. Let's go down to ATL, Atlanta, Georgia, and Andre Russell, who has a barbershop in the busiest airport in the world, Atlanta, Hartsfield, Jackson Hartsfield Airport. Just a couple of words before we get started. You need to unmute. You need to unmute. I'm not hearing you.
Yeah, I don't see his mute button, but I
I
don't
don't
hear
see
him.
his mute. Yeah, yeah. So something happened.
Let
was
Meg work with him.
Meg, see if you can take him in the back room and get him going. I'm gonna go with Greg Rucklich.
Hey, Greg, he's a new one.
Yeah, absolutely. Introduce yourself to us, and we got a few seconds to let's talk about what's your take on the show today.
Well, I apologize for my tardiness. I had a class that ran over, but the information is great. I think that is very important, and we try to my students. I try to get them to receive that same message and also to push it forward. You know what I mean? Health is everything in this industry. Well, as human beings, period, not just the industry, but as human beings, period. We want to be in the best of health and the best of situations, and that's your longevity. And, I remember when elders used to live to like 96, 97, almost 100 years old. And I know everybody's concerned about their lifespan, but, health, that's your wealth. And I think that is like major. And I think that I'm vegan. So I've been vegan going on 2 years now, and I completely changed my life. So I know the benefits.
Thank you so much. Very, very nice seeing you. Go ahead, Doc.
We're on time. He was a first timer. I wanted to see where his shop was, but go ahead.
Yeah, no, you can tell us just where the shop is.
Yeah.
I'm so sorry. My school is located in Greenbrier Mall here. I'm in Southwest Atlanta.
Okay.
So
okay,
good. Wonderful. We
okay.
got a school here in the house.
All right. Andre, you got 2 seconds. And I didn't do your mute thing. That was not me. You can unmute and say something. You're not still not there. Well, just wave. There you go. That's communication. Waving is communication. That's snap him up, right? All right, Katrina, I don't see your thing. You're on. You say something, Katrina Randolph.
Hello, everyone. How are you? I'm Katrina. As always, this is great information that we can always share behind our chair. Every time we come to this platform, we learn new information. And this is definitely what it's all about, being able to share preventative maintenance behind our chairs. So I'm always honored to be in the room. Thank you.
Right. At College Park, Maryland, right? Somewhere in that area, right?
Capitol Heights.
Capitol Heights, right? Gotcha.
One of our community health workers who's a stylist.
Absolutely. And doing her thing all over. And that's going to do it for us. Let's bring up the word cloud and we'll go out with that. Look at that.
Okay.
The larger the word, the more people said it.
That's right.
And what just stands out, the most prominent word is informed and thankful. We know that we are informed because we listened to, people who poured out their hearts with knowledge about the heart. And we're thankful, we're grateful, we're appreciative that they have been here to share with us with such important subject. Impressed, blessed, concerned, consistent info, grateful, excited, and educated.
There you go.
So we this was just fabulous. Thank you all so much for joining with us on this segment of The Cutting Edge. Dr. T, wow. Well, it was a lot to do. Dr. Renee Damaris, thank you so much for what you do. You gonna come back and hang out with us, right? Absolutely. We love it.
Thank you for letting me on the show. I really appreciate it. That was great.
Absolutely. Dr. Muhammad, thank you so much for what you do. Boy, just powerful. I just look for the conversation and look for the invite, right? Because both of you all will be back by popular demand, right?
We'll start following Heart to Heart.
Absolutely, and follow Heart to Heart. So we're gonna follow you, and we're gonna hang out. So we're here now, right?
I would love to be a part of continued conversations. I love having conversations like this. It's important for all of us to engage and get the good information out there and have fun. It was so much fun.
Absolutely. And Aaron Perry, my man.
Black Men Run.
Absolutely. That man, thank you for the work you're doing, man. You're putting it's not you're not just talking the talk, but you're walking the walk.
There you go.
And we are so appreciative of the work that you do, putting what you are saying into action. I
Right.
appreciate that.
Let me
Dr.
say
Ritter,
one thing.
go
Oh,
ahead.
I'm sorry to interrupt, but I just may want to say one thing. I am so impressed by Mr. Perry and what he's done. That is just amazing. And I'd love to get to talk to him some more about a lot of this stuff. So we gotta get together, Mr. Perry, if you don't mind.
Well,
Sounds
Dr.
good.
Renee,
Dr. T, if you can share my information.
absolutely, you're one step away. That's the whole point of our medical society, seeing best in class, best practices that we've identified around the country.
Right.
So absolutely perfect. That's exactly
What he has is empathy. He just oozes empathy, and that's the most, in my view, the most important part of a leader right there. And that's what he does. So kudos to you, my friend.
Good.
Thank
Thank you so much. All right. Dr. Ritter, thank you so much. Love to you and all you do. Mr. Reckless, you need to just hang out with us, man. Don't make yourself a stranger, okay? And Mr. Russell, we recognize that sometimes things happen that way, but those things understood need not be explained. You know we love you with a perfect love, right? All right. Well, that's gonna do it for us on this segment of The Cutting Edge. Dr. T, man.
wow.
Man. Wow, what a show. Well, until our next Cutting Edge, the next Cutting Edge, we will have a family reunion. So we're going to be inviting people back who've been on the show for years, for all around. So it's going to be a culminating show for us. And I forgot to say, Sandra Jenkins, yes, love you, and Miss Reynolds, for make sure that I say that. But we're going to have a really powerful show in December with the family reunion. And with that being said, Dr. T, I'd like to leave the audience with these two words. Remember that I love you with the perfect love. But more importantly, remember this. You got the power. Until the next Cutting Edge, have a wonderful day.
You
Bye-bye.
got the power. Health as well. Bye-bye.